Hello everyone, my name is Alexis Washington and I will be discussing nursing history presentation as a part of the Nursing 346 Evolution of Professional Nursing class. For this class, I decided to do my presentation on the book Making Room in the Clinic, Nurse Practitioners and the Evolution of Modern Health Care, Critical Issues in Health and Medicine, first edition. Learning and educating myself about the history of nursing has proven to be very interesting. I think being educated on the history of nursing should be a required part of any nursing professional's career because of the impact it still has on nursing today. Knowing the background and the foundation of what nursing practice is based on is also an important factor when thinking about how today's nurses are being educated and implementing different skills into current practice. Looking at history from a clinical perspective also allows the practicing individual to appreciate the other roles of their coworkers and develop a deeper understanding of why their role is so important and necessary in their area of the clinical setting. Discussing history as a pedagogy, after reading Making Room in the Clinic, Nurse Practitioners and the Evolution of Modern Health Care, Critical Issues in Health and Medicine, first edition, the nursing pedagogy was very apparent. The author did a very good job at describing hardships and difficulties nurse practitioners felt while trying to find out the true meaning of their own identity and existence. It explains how this role of nurse practitioners came about during a time where healthcare was growing in many different ways. In an attempt for everyone to become on the same page without practicing the same job responsibilities, all of the sub-umbrella professions, such as nurse practitioners, physician assistants, etc., performed their own individual job versus being referred to as the physician extender. To further influence the developing practice of nurse practitioners, one of the first physical examination guides were produced by two professors, Professors Bates and Lenall, who were physicians at the time, and it was geared towards helping and preparing upcoming nurse practitioners understand and learn quality examination techniques. This also included supporting text and diagram data that explained the human body. These two professors also had a strong influence on the developing program and curriculum that not only helped develop nurse practitioners, but to help them be able to teach others the same skills and apply these skills to patients they took care of. This helped shape nursing identity by providing learning tools needed to succeed. It challenged individuals to think critically and learn to apply medical practice along with the nursing compassionate-like approach. Nursing history was evident by the witnesses it bared, by giving voice, and the myths it dispelled. This particular selection showed that by the following quotes, I will quote from the selection and explain. Bears witness. Nurse practitioners were reconceptualized as low-cost providers, and through a growing recognition of their proficiency and efficacy, became part of the savings and health prevention measures that grew up in the 1980s. After reading the text, it became very apparent that nurse practitioners were a beneficial addition to the nursing field. They have been trained similarly in the same context as physician assistants and are also paid in most cases in the same pay range. Gives forth. Instead of viewing the field as a new category of health, the profession of a nurse practitioner was described as merely just an expanded role of nursing. The nurse practitioner was clearly a nursing model, a verification of what she was already doing, and a way to expand and improve access to health care for underserved populations against the backdrop of a physician shortage. Nursing was able to continue to make their impact on healthcare while also changing and improving the livelihood of people's lives. Dispelling myths. The social status of nursing is based upon its historical perception as a woman's profession. This quote helps serve as evidence that nurses don't have to only be women. Men can practice as nurses as well. Pointing this out and making it apparent in this text helps the reader understand that. It also discussed the involvement of corpsmen in different areas of the military that perform nursing duties when in combat or while working in a military healthcare facility. This practice is also still very common today. Explanations in health while reading the text included, but not limited to, the following points. It's been suggested that strategies that prove as most effective occur at local and national levels when the organizations from these entities show common purpose and methods. National organizations such as ANA still work together with local organizations to come up with methods that will further improve nursing practice. In the critical period of the 1960s and 1970s, the nurse practitioner movement helped create an influential foundation for health policies that emerged in the last 28 years, including health maintenance organizations, a renewed interest in health promotion and disease prevention, and consumer-based services. This is a detailed reason of how nursing history currently still has a huge impact on nursing practice today. Most of the policies and procedures practiced clinically are based off of what early clinicians had the privilege to put in place. A lot of evidence-based practice nursing initiates from a study or an issue that has been brought up but may need improved implementation strategies in order to better benefit the profession as a whole. Reading this book has really gave me a expanded and deeper understanding of nursing as a whole. I hope you guys enjoyed my presentation. Thank you.